Brennan with the Colorado Consumer Health Initiative. CCHI is a healthcare advocacy organization that is working toward more equitable, affordable, and high-quality healthcare. And one of the ways that we are doing that is by demanding accountability from pharmaceutical companies for more transparent and affordable drug prices. We are running a bill this session, and I'm going to turn it over to Isabel Cruz to talk to you about the bill, and then we'll hear some stories from people who have experienced high drug costs and what that has meant for them. Thanks, Adela, and thank you everybody for being here with us in person, virtually. My name is Isabel Cruz, and I'm the policy manager for this fantastic organization called CCHI. And I'm here today because the time is now for our legislators to take action beyond transparency to bring accountability to the pharmaceutical supply chain and deliver real savings for Colorado. CCHI has worked tirelessly to address this issue in Colorado because we know that Colorado and its residents have a big stake in the rising costs of prescription drugs. Year after year, we face strong, well-funded opposition, and we have persisted because we will not give up until no Coloradan has to choose between paying their rent and supporting their prescription medications. That is why we are so proud to be here pushing to pass SB21-175 to create a Prescription Drug Affordability Board. It is no secret that prescription drug costs are the fastest growing consumer health expense, driving up hospital and insurance costs, as well as costs for our state government and for employers, particularly small businesses who are struggling so much in this time. Before COVID, nearly 1 in 3 Coloradans struggled to afford their prescriptions, with many forced to make impossible choices between filling prescriptions and paying for rent or food. While this pandemic has increased the importance of staying healthy, the economic fallout has increased barriers to accessing healthcare and prescription drugs. A national survey showed that almost 60% of uninsured patients and those with ACA or PA plans reported cutting pills or skipping doses, with the general public reporting 40%. These statistics are staggering for real saving costs. At CCHI, we have connected 270 stories this month with people processing or scrambling to afford their medications and pay their bills. We've heard from numerous people who are rationing their medications to save money, or even to help their families or others in their communities, putting themselves at risk to make sure others can get their needed meds. Everyday people are creating a patchwork of solutions in the absence of legislative action. We need our legislators to help bring costs down for Coloradans. Creating an independent board with the ability to investigate, review, establish more affordable costs for the most expensive and unaffordable drugs in Colorado by passing SB21-175 is an important step forward to mitigate the affordability crisis facing Coloradans, particularly people of color and low-income residents. The PNAD model would extend long-standing methods of protecting consumers in other contexts, like public utilities, to prescription drugs. Setting an upper payment limit will require entities in the supply chain to do what they do every day: establish different discounts for different customers. Drug manufacturing companies spend billions of dollars per year on marketing and direct-to-consumer advertising, as well as paying out enormous fines for business purposes. Even in the midst of the pandemic, they have continued to choose profit over people and increase prices well beyond the rate of inflation on a historically large quantity of drugs this January. The pharmaceutical industry's claims about trust, innovation, and access are unproven. However, inequitable access
everyone. My name is Angie Patton. I live in Denver and I'm a registered nurse here in Colorado. I've been working in healthcare since 2014 and I've been an RN for 2 years. No matter where I work or what my title is, it's an inescapable reality that exorbitant drug costs often stand between my patients and their quality of life and have the potential to quite literally kill them. I'm speaking to you today as a patient advocate in support of Senate Bill 175 because every person, regardless of income or insurance coverage, should have access to affordable medications. It is my duty to tell you that this is not the reality for many Coloradans, and it is our elected representatives' duty to do something about this. Chronic conditions require daily management and maintenance, and prescription drugs play a critical role to the health of individuals managing these conditions. These kinds of medications are intended to be taken every day, sometimes multiple times a day, and the inability to maintain the regimen as written by your prescriber can have severe, even fatal consequences. Many patients have multiple chronic conditions and find themselves juggling the cost of numerous medications. All patients with chronic conditions face never-ending struggle to manage their costs of treatment, but not everyone with a chronic condition faces the same struggle to afford their medications. Communities of color, low-income communities, elders on fixed incomes, and individuals with disabilities must navigate these issues with more regularity and often have poorer outcomes than patients from more affluent, disproportionately white communities due to many levels of inaccessibility, one of which is undeniably the cost of medications. Many of those without insurance or with insurance that leaves large gaps in their care work in fields that do not compensate them fairly or receive aid that requires them to remain below the poverty line. It is unreasonable to expect that people falling under these categories can figure out the cost on their own. Almost no patient is safe from price gouging. Basic drugs that are critical to survival for so many, like insulins, are not affordable to all patients. A person has a right to life-saving medications. Newer drugs and drugs for less common conditions are often more expensive and less covered by insurance, but that doesn't make them any less necessary. A person has the right to afford the treatment their provider prescribes. Sometimes treatments are prescribed for ease of use, increasing quality of life, and all patients should have equal access to the best possible outcomes. Patients unable to afford one or several of their medications may ration them, choose between them, or even stop taking them altogether if unable to afford them out of pocket. This can have life-threatening consequences, and these patients are more likely to end up back in the hospital. The best case scenario here is that the individual ends up in a less physically and financially capable situation to manage before they were before their hospitalization. And I shouldn't need to remind you what the worst case scenario is in this situation. So with that, I just want to say once more, please support Senate Bill 175 because really our Colorado healthcare consumers are in dire need of affordable drugs. Thank you.
Thank you so much, Angie. That was so powerful. My name is Rachel. I'm the field coordinator here at CCHI. And I want to thank everybody for being here today and showing up. Seriously, it's amazing that you guys are all here. All right. Over the past few months, we've been calling Coloradans all around the state and asking them to share their experience with high prescription drug costs. And as I've done this job, I have seriously been heartbroken. I have heard stories from people who got choked up when they described the pain that they felt when they see that children in their communities aren't able to get the life-saving drugs they need simply because their parents cannot afford them. I talked to another person who had to watch as her friend's son died of brain cancer because she couldn't afford the drug that she needed to save his life. We as a state know that prescriptions don't work if we can't afford them. It's really that simple. No one should ever have to choose between paying for basic necessities and paying for the medical care that they need, or that could even save their life. Coloradans should be able to get the medications they need here, not forced to move out of the state to find the health care they need, or to travel to another country in order to get the prescription drugs that can save their life. Yet, we have talked to so many people throughout this campaign who have to make these difficult choices every single day. So now, I would like to share with you some quotes from people that we have talked to who are not able to be here for various reasons, including health concerns. Michelle, 53, Pueblo County. Prescription drugs are extremely high, and it's absolutely intimidating to have to take medicine that is needed when you can't afford it. You have to choose to eat, heat your home, or get your prescriptions. Christopher, 29, Boulder County. I am a type 1 diabetic, and the prices for my medical needs are horrible. I am billed outrageously just to live another month. I have had to choose food or medical care so many times in the past. Takesha, 52, Denver County, says, my mother had to choose between paying her bills and buying her groceries or affording her medications. Bonnie, 34, Jefferson County, says, as someone who is chronically ill and had to buy prescriptions from Canada because it was most cost effective, and even then it wasn't affordable, I'm pretty unhappy about the cost of prescription drugs. It has destroyed my life, destroyed my credit, and destroyed my ability to live in my beloved state of Colorado. And let me be clear, I feel extremely lucky compared to other people I know with chronic medical issues. Our lives are on the line. Michael, 25, Pueblo County. Healthcare is something I do not use. Making less than the poverty line for my household makes healthcare a luxury item, not a necessity, due to actual necessities being the priority. Stephanie, 53, Larimer County. I think pharmaceutical companies are only out to make money. They do not care about their consumer responsibility. One of my prescription costs more than my rent and about 86% of the money I get for disability. Denise from Denver County. Insurance companies are not incentivized to help consumers save money on prescriptions, only to help reduce their own costs. Callie, 29, Adams County. I feel like prescription drug costs are ridiculous. My insurance doesn't cover much of my life-saving medication, so I take it once a day instead of twice to make it last longer. Sergio, 40, Adams County, says, I recently had a stomach virus for which the medication cost $3,000. If I did not have insurance, it would have cost me a month's worth of work. And finally, from Sandra, 71, Adams County. When I experience a sudden change in my medication's price, I cut back in other areas of my health care. I don't fill my prescriptions, I don't make appointments. I delay taking care of myself. I cut back on other things like entertainment, taking trips, and going out to dinner because I've prioritized my health. This results in me staying close to home, being isolated. Thank you very much.
Oh, have a Della close.
Does anybody else want to take the mic? I know. You want to close this out here?
Can Adela close out?
Okay, thank you everyone for being here. I know it's difficult times for us to be trying to do a socially distanced rally, but this is also difficult times for people who can't afford their prescription drugs. As Rachel said, they only work if you can afford to buy them and take them. So please help us by supporting Senate Bill 175 by calling your senators and representatives and sharing your story with us. Thank you.